if it's simple, meaning not anaphylaxis, sometimes patients will work with allergists to pre-treat themselves before getting the flu shot. Other times I will suggest if it's too much of a mental load to do all of the pre-treatment prior to getting the flu shot, I will tell them, I will advise that everyone else in the household get vaccinated, just so there is some sort of herd immunity in that sense. And sanitize. Hand washing is so important at all times, as we are learning, but especially during the flu season. If you have an egg allergy, again, if it's more GI symptoms like nausea, vomiting, because the flu shot, the kind that we carry in our office is preservative-free and egg-free, but for the offices that don't have it, if the side effects are more GI related, usually those side effects don't cross over with the flu shot because it's not going through your GI tract. The true contraindication would be anaphylaxis with any prior allergic reaction. But again, have a candid conversation with your doctor. That's a decision that you guys could make together. I think there was a question whether the talk will be posted anywhere. Yes, I think Dr. Malik had posted earlier in the chat. It will be posted on YouTube. You can subscribe to the channel by clicking on the link. I had also gotten a question through Instagram about lifestyle changes and modifications, how to start with a diet, where to start. I briefly went over kind of my overall ground rules, depending on what type of eating plan you want to follow. I hope you guys got a chance to listen to Dr. Amy Shaw and Dr. Rupa Wong's talk earlier about intermittent fasting. It was fabulous. There's a bunch of good scientific data that backs it up. But whatever you choose to do, you have to be mentally ready. And it's like, I feel like I have a similar conversation with my smoking patients and my patients who are having trouble sticking to a good eating plan. You have to be all in. And why not? I mean, this is your health. This is your future. I also recommend detaching yourself emotionally from food. I think mindfulness eating is so important, but you know, in our culture, we celebrate with food, we get bored with food, we mourn with food. Try to detach yourself. Use food. Look at food as strictly nutrition for your body to keep you mentally and physically well now and in the future. And once we stop attaching specific things and specific emotions to food, it also makes it easier for us to approach things differently with a different mindset. Let me see if there are any other questions in the chat. Should you get shingles? Oops, sorry, hold on, let's see. Should you get the shingles vaccine if you've had shingles? Not necessarily. Some patients, depending on your risk factors, if you're below the age of 50, would benefit from the shingles vaccine. But talk to your doctor and also talk to your insurance company, but because not all of the time, if you're under 50, it's not always covered and it is kind of expensive. Sonal mentioned, can you talk about the HPV even in adults who are not sexually active? I often get South Asians above 18 who do not think they need to be vaccinated because they're not sexually active. That is a great question and a great point. And I also get the same question about pap smears as well. Even if I'm not sexually active, do I need to get a pap smear? Simple answer is yes. At some point in the future, there will be sexual activity. It's basically how I approach it with my patients. And that vaccine and or your pap smear will protect you and will screen appropriately to help protect your health in the future. Let's see. I think those were all the questions. We'll move on to the next chat. Thanks, guys, so much for listening. I really appreciate it.